switching gears a little bit, I'm just curious in general, could you just talk about, I'm thinking of a patient who might be considering surgery and they're nervous about the side effects. You just gave us two examples. We've got craniotomy, we've got laser surgeries. One's a little more invasive than the other. Can you tell us what the recovery time is like for each and maybe what kind of side effects patients might be dealing with?
Sure. I think obviously what I'm about to say is not true for everybody. There's variation across the board. If I perform a craniotomy on someone, which is the larger, more invasive option, of course, typically, I would say most typically people leave the hospital 2 days after surgery. There are some folks that are just really motivated to get out of the hospital. Certainly COVID has served that motivation purpose in the last year and a half, who often will leave the hospital even the day after surgery. But some folks are, of course, need to be there longer than that, a few nights. And then overwhelmingly, most people are able to be discharged home, but depending on where the tumor was and what some of the swelling in around that area may cause symptom-wise for a period of time after the surgery, some people may need brief stays in rehab facilities to get some of their strength back, et cetera. For the laser procedure, everything's a little faster, not surprisingly. So whereas a patient might spend one night in the ICU after craniotomy, they are unlikely to see the inside of an ICU after the laser procedure. Typically, I said we send people home the following morning, but also with COVID, we've increasingly been able to successfully send people home the same day as the procedure. And so it's usually at most one night in the hospital. Of course, again, same issue. If someone's having some weakness due to some swelling, et cetera, they may need to stay longer and they may need a brief stay at rehab, but that's pretty unlikely. I think most people feel that they're after a craniotomy, which is again that larger procedure, by 2 weeks, most people feel that they're about 90%. And then I always tell people that last 10% of your energy levels takes another 4 to 6 weeks to come back. So most people are out of work for, I'd say on average, about 4 weeks after a craniotomy. And those periods of time are shorter for the folks that undergo the laser procedure.
Right. That's actually, it just kind of amazes me that we can go into somebody's brain and people can leave the next day or 2 weeks later. It's pretty amazing. And when you said weakness, does that mean people have trouble like lifting, maybe walking, lifting up their arms, like doing things for themselves? Is that when you mentioned weakness, is that what you see?
Yeah, generally, in the brain, one side of the brain tends to control the other side of the body. So and a lot of the lesions that we intervene upon are located near areas in the brain that control strength on the opposite side of the body. And so there may be a period of time, for instance, in the days after surgery where there's some swelling around that. And the way I explain it to patients is, look, if I operated on your ankle, you'd expect to have a swollen ankle the next day. The brain's no different. And if we operate on your brain, it's going to swell a little bit. And that swelling in the brain looks a little different than a swollen ankle. So I say, if you had a swollen ankle, you may limp. Well, this is the brain limping. It's producing a little bit of weakness, maybe some hesitant speech, and it all really matters where that lesion is in the brain that we're operating on. So for instance, for lesions that are right near those, what we call eloquent areas, or areas that are really important for what they control, the swelling into those areas may produce symptoms that take a little time, days, maybe even weeks to resolve. And that's kind of what we're talking about.
Okay, thank you. What are the risks? There must be a few risks involved in brain surgery. You just mentioned swelling. Are there other risks involved, maybe more long-term side effects that patients might experience?
Yeah, so I think when I provide risks to a patient, I kind of divide it up into a few different categories. So I say, first things first, all surgeries have some risk. And no matter where we're performing surgery, there's a few things that are common to all those surgeries. Number one, surgery tends to hurt. So we put folks on pain medication before, during, and after. You mentioned how we can go into the brain and people do well. The brain doesn't have pain receptors. The brain doesn't hurt. Now the scalp hurts and the dura hurts, but that's really about it. So most people tolerate the surgeries better than, say, like a big belly or chest surgery where we really are sore and can't move around afterwards. People are up walking around the next day, maybe with a dull headache, but that's about it. So pain doesn't tend to be too bad for brain surgery. There are some exceptions, of course, but we'll just leave that as a broad statement. Bleeding. All surgery produces some bleeding, but in general, the bleeding from brain surgery is pretty minimal, and the chance that you would require something like a blood transfusion is almost next to zero, barring getting into an artery or something that really causes some blood loss, but that's unusual. And then all surgery has a risk of infection. We usually say about a 1% chance of infection following a surgery. So we put people on antibiotics just around the procedure, but not for very long. All surgery in the brain produces some additional risks. It can cause strokes or seizures because we are near blood vessels that feed parts of the brain. We, as surgeons, try to avoid those blood vessels, and so we try to reduce the risk of stroke on our own. As far as seizures are concerned, I tend to put patients on an anti-seizure medication for a period of a couple of weeks after surgery. Those practices vary across surgeons. And just to kind of stave off evil spirits, if you will, but it's the far minority of patients that have issues with that. And then the biggest risk that we kind of talked a little bit about is that swelling that can cause things like weakness or speech deficits or confusion or dizziness, all depending on where that tumor is in the brain. But there's, of course, a risk that if we're near those structures that are so important, that we can cause more permanent deficits, more permanent neurological deficits. That's what we're, of course, really trying to avoid, being exceedingly careful in our surgery. And I would say overwhelmingly the majority of our patients do not have long-term effects of the surgery if the surgery is done well.
Okay, great. I mean, I think it's just important for patients to remember that when we talk about the uniqueness of each individual patient, that really you are taking into consideration all of those factors as to whether or not a patient may experience long-term side effects depending on the location of the tumor. So yes, there's risk involved, but like you said, there's risk in every surgery. So thank you for sharing all of that information.